Advanced BioStructural Correction, also known as ABC, is fantastic at reducing pressure and stress in your joints, muscles, and organs to help relieve stiffness, pain, and poor function. However, the true power of ABC is that repeating the protocol over time, and following the essential ergonomic advice, unlocks and corrects the layers of accumulated misalignments, to make your body look and behave as if it is years younger. This process is called unwinding. Unlike treatments that aim to just relieve your symptoms, we are trying to resolve the underlying cause. The difference in how you will look, feel, and move compared to normal treatments is night and day. Anything worth achieving requires effort and consistency. An athlete who sets a goal to complete a competition cannot expect to win without sticking to a proper training plan. Sometimes the athlete may feel like quitting, but they must persevere. It is tough, and there is some pain, but there is also an understanding that the pain is necessary to accomplish the goal and reach the finish line. If your body is misaligned because of mechanical injury, unwinding can help you heal in much the same way that an athlete trains, by repeating movements regularly and helping their body to heal and restore between training. In your case, there will be some tough times as your body unlocks and untwists, but your body will improve massively as your care continues. No other treatment can do this for your body structure. The aim of each ABC protocol visit is to get your body effortlessly upright and balanced. Your body then relaxes in a way that cannot be achieved with any other method, and enables it to untwist and unlock deeper layers of misalignments. During your visit, we use a simple but accurate test to locate the exact bones that need correcting. We then start by loosening up the twist in your spine where the misalignments are locked up with spinal stretches called meningeal releases. Meningeal releases are unique to ABC, and they often give instant relief to many symptoms. We then correct specific misalignments in the entire body. Knowing what to correct and what to leave alone is another unique property of the ABC protocol. This leaves you more upright, bright, and alert since your body is aligned well enough to stay balanced with no effort. Ergonomic training and advice will also be followed between visits to help you unwind properly and prevent new misalignments. Following this advice is more effective than exercise at helping you unwind quickly. Before you start care, you have symptoms and physical restrictions that result from mechanical injury such as pain, loss of motion, stiffness, etc. You are usually stuck in a forward position, i.e., leaning forwards, twisted and off balance. With ABC, we start to correct your body's mechanics by working on the current layer of issues that shows up on testing by correcting the positions of out-of-place bones that your body cannot self-correct because it has no muscles pulling in the directions needed to reposition those bones. Between visits, your body corrects the things it can self-correct, revealing a deeper layer that we can then work on during the next treatment. We then work on that new layer by repeating the above, and so on and so on. On average, 2 ABC corrections a week usually result in relief of your presenting symptoms within weeks. In severe cases, this can be much longer. Beyond that, we can do much more for your physical health if you keep it up. Once you have relief, the next stage is to stabilize your body in its new, better alignment. This phase releases many more injury compensation layers, resulting in major improvements to how you look, feel, and move. To optimize your body and reach the peak of what unwinding has to offer takes about 3 years or much longer if you are over 50 years old or your condition is severe. During unwinding, your body structure will still be falling and twisting in various directions as you unwind. You won't just straighten all the way up in one visit, your posture moves around a lot on the journey depending on the layers still left to correct. This means that you will have different symptoms at various points in your recovery. This is very important to realize, so is worth repeating. You will have different symptoms from the ones you started with at various points in your recovery. Once you reach any point in the journey where you are happy, we recommend fortnightly to monthly corrections to help the changes become more permanent and to protect you from the misalignments that build up from normal daily stresses. This way, we can help you stay well indefinitely. The more you unwind, the better your entire body feels, works, and looks. The eventual benefits to your quality of life and productivity are life-changing. Overall, weak muscles become stronger, you become more mobile, your balance improves, your brain functions better, you can breathe more easily and do not tire as easily. In essence, We are making your body behave physically younger so it works better overall and lasts longer. Continuing with protective or optimization care will greatly reduce the risk of developing common problems associated with aging, since body alignment and posture are associated with every physiological function in your body. Your body usually starts to improve by untwisting in a backward direction away from the major mechanical stress problem, the first upward blue line on the graph. Remember in the assessment where we found out if you were twisting left or right? That is the side of your major mechanical stress problem. Untwisting backwards is called backward unwinding, and usually relieves some of your symptoms and helps you be more comfortable as we are reducing the stress in those injured areas. To continue improving, there will be times when your body partially untwists forwards again, towards the original forward stuck injury position, first downward blue line on the graph. At this point, you may feel pain in an area of your body that was injured in your past, or sometimes a new pain or symptom you are unfamiliar with. It hurts because your body has stabilized and recovered from enough damage that it is starting to use that area again. However, that area may not have had any force going through it for years, so it is not used to stress because the body had been protecting it. So those structures will ache and hurt, and you may feel anxious, depressed, and fragile because the increased pressure leads you to think you are getting worse, but be assured that you are improving. This is similar to when you start exercising after a prolonged break. People will often say that they are aching in places they don't usually ache, and often where they did not even realize they had muscles to ache. This portion of the process is called forward unwinding, and is a good sign that the body is continuing to unlock. You may need extra visits during this time to help you with your symptoms, but they will pass and you will be backward unwinding and feeling better before you know it. Forward unwinds will be very challenging for some, so be prepared for some difficult times. This process of going backwards and forwards is known as unwinding and is necessary for your mechanical injuries to heal. You will usually encounter your first forward unwind within the first 12 corrections. However, they can be unpredictable, so work with your practitioner to get through these times. Remember that they are necessary, temporary, a good sign of improvement, and show that you are starting to use locked up areas of your body again. Each old misalignment injury you have built up must be released this way to achieve optimal structural health. That is why so many people have injuries that seem to hang around forever, and other treatment methods only improve people a little and don't get them 100% again. We will be giving you a lot more training on unwinding during your visits to us and look forward to getting you well again.